Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Thursday, April 2nd, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen, and Fire Chief Matthew Pegg. He's also the General Manager of our Office of Emergency Management. For the journalists on the line, please note that Police Chief Mark Saunders is also here to answer any questions you may have during the Q&A session. Mr. Mayor.
Thank you, Brad, and good afternoon, everybody. Today I have signed a bylaw using my authority under the city's emergency declaration to impose a 2-meter physical distancing rule in all city parks and public squares. Any two people who don't live together who fail to keep 2 meters of distance between them in a park or public square will be subject to prosecution and will, upon conviction, be liable for a fine of up to $5,000. It is our expectation we will soon have the required permission to issue a set fine ticket for this offence in the amount of $750. I've signed this bylaw, which is in effect for at least the next 30 days, to further drive home the message that people have to keep their distance from each other to avoid spreading COVID-19 further in our city. This is a deadly virus that has already tragically claimed the lives of Toronto residents. Given the surge in cases and deaths that we have seen in places like New York and Italy, we must do everything we can to stop the spread of COVID-19 now to save lives in the weeks and months ahead. This is but one more measure we are taking so that your city government can assure you that we are doing everything we can to stop the spread of this deadly virus now. Yesterday, I supported Dr. Davila's unprecedented action to quarantine all Toronto residents diagnosed with COVID-19, residents awaiting test results, and people that public health investigators classify as close contacts of those who have been diagnosed. We have done this to further stop the spread of COVID-19 in our city, and I hope anyone caught violating those quarantine orders will be given the full $5,000 a day fine for their blatant disregard for their fellow residents and actions that put lives at risk. We also gave clear recommendations from our public health professionals that everyone should stay home as much as they possibly can and limit outside trips. I do want to thank the vast majority of people in our city who are doing the right thing, following the advice of our public health officials and staying home as much as possible, often at considerable sacrifice. To those responsible and good citizens, thank you for helping us to save lives. We're saving lives together. But we continue to see, especially as the weather improves, people ignoring that advice and, even worse, flocking to parks and even using closed playgrounds, closed parking lots, and gathering together with others to play sports in the parks. This will further the spread of COVID-19 in our city and will contribute to the costing of lives. The science and the trend lines taken across the city tell us this, and that is why we brought forward extraordinary measures yesterday to stop the spread and to save lives. Not only does this misbehavior on the part of a small number put people's own health at risk, it puts their families at risk and all of our families across the city, for that matter. It will also prolong this terrible emergency and the damage it is doing to the lives of residents, to their employment, and to their finances, prolonging this trauma for many more months. Why would we want to do that? That is why I've reached out to Police Chief Mark Saunders and City Manager Chris Murray to mount an ongoing blitz of our parks using the existing bylaws and provincial emergency orders along with the new bylaw that I have signed today. This is an all-hands-on-deck effort. We have a COVID-19 enforcement team, including Toronto Public Health, Toronto Police, and municipal licensing. We are calling back and deploying 200 bylaw officers along with public health and police officers, including the mounted unit. Around 15 sets of concrete blocks are being dropped at parking lot entrances, including at Sunnyside Park. I regret the fact we have to do this. You'd think that locking the parking lots and putting up gates and padlocking them would be enough, but we've had to do more because of what we've seen happening in the last couple of days. We will also be asking parking enforcement officers to patrol neighbourhoods to help educate people about the dangers posed by violating some of these recommendations and rules that have been put in place. Should people cut through parking lot barricades again and park their cars in closed lots, staff will take action. We did 4 friendly tows yesterday so we could clear out 1 parking lot. I can tell you the time for friendly tows is over. The number of hotspots being managed by Parks, Forestry and Recreation staff, along with municipal licensing and standards, and the Toronto Police has grown to 42. We've received 1,180 complaints. Since March 24th, municipal licensing and standards has responded to 288 complaints, issued 34 notices for failure to comply with the EMPCA order. Since March 24th, Toronto Public Health attended 279 bars and restaurants that were identified as non-compliant, 94 of which were closed. 12 warning letters were issued for premises non-compliant with the dine-in prohibition. Toronto Public Health has also attended 62 personal service settings, nail salons and hairdressers. Around 54 were closed, and 1 warning letter has been issued. The time for puzzlement at this misbehavior is over. Lives are potentially at stake, and we will turn up the heat in the hopes that the few who still don't get it or pretend not to get it will get with the program. So I have sent a clear message to city staff this morning, and I want to send it to all residents as well. We will continue to do everything we can as a municipal government to lock the city down in order to save lives. To do less would be to ignore the lessons of New York City, where in the past 2 days, almost 200 people have died, bringing the total to 1,374 deaths in just over a couple of weeks. I cannot and will not allow Toronto to go down that path when we know there are things we can do, recommended by our medical officer of health and her professional team, to avoid that kind of circumstance. Tomorrow, the province will be releasing its modeling numbers. That is the right decision. People deserve to know the very real threat we are facing and why all of these actions are necessary. I'm confident that we will get through this and that we will save lives, but only if everyone does their part to stop the spread of COVID-19. I've spent my entire life in this city. I know the residents of this city, and I know their ability, the vast majority of Torontonians, to work together and to do the right thing. I also know it's the first time in generations, the first time in my lifetime, that we've had to communicate to people a broad-based threat to many, many lives right here in our own city. Something, quite frankly, we're not accustomed to hearing in this city. I believe at the City of Toronto we have been clear about the real risk to lives in our city, about the actions we must all take and the work we are doing to enforce these measures when that becomes necessary. Armed with this knowledge, I believe the people of Toronto will do the right thing. They will stay home as much as possible. They will keep their distance from each other by at least 2 meters. And if they get sick or have symptoms, they will quarantine themselves to avoid spreading the virus to family, to friends, to neighbors, or any other place further across the city. I know we have the smarts to understand what we must do to defeat this virus and get back to our treasured way of life. The question is, do we have the solidarity and the will to do it? I say, yes, we do. So let's get on with it. Thank you for your time today, and I'll now ask Dr. Davila to provide her update for today.
Thank you, Mayor Tory, and good afternoon. As of 1 o'clock this afternoon, there are 897 cases of COVID-19 in Toronto. This includes 727 confirmed cases and 170 probable cases. There are 86 cases that are hospitalized, 39 in intensive care units. Approximately 26% of these cases are attributed to community spread, and there have been about 11 COVID-19 deaths in total thus far. I am aware, however, of others that my team is currently gathering details on, and I will report on these numbers when the facts are confirmed. In the meantime, I extend my sincerest condolences to the family and friends of the individuals who have died thus far. Yesterday, we announced a number of measures to save lives, to protect and preserve the capacity of our healthcare system, and to minimize the social and economic impacts of COVID-19 on our city. I have received a number of questions around what yesterday's orders mean for our residents. Simply put, they mean the following. Anyone with COVID-19 who is not hospitalized is required to stay home and self-isolate for 14 days under the Health Protection and Promotion Act. Anyone with signs and symptoms of COVID-19 or waiting for their test results is required to stay home. Anyone who has had close contact with a person with COVID-19 or someone with signs and symptoms of COVID-19 is ordered to stay home for 14 days. If you have been ordered to stay home for 14 days, this means that you are not to go outside for any reason, except on a private balcony or an enclosed yard, if those are available. You are not to go for a walk or to go to the store to pick up essential supplies. Others will have to buy your groceries and supplies for you during the self-isolation period. To be clear, these requirements were already in place. The order, however, underscores how important it is for these people to stay in self-isolation, to protect our community. Under the local order, if you do not comply, you may be liable to a fine of up to $5,000 for each offense. We expect and hope that people will abide by the self-isolation that is required of them because they care about themselves, they care about their health, the health of their loved ones, and the health of their community. For everyone else in the City of Toronto, and I do mean every single person in Toronto, please stay home. Unless you are a healthcare or other essential worker, only leave your home to access healthcare or medication, to shop for groceries or other essentials, ideally only once per week, to walk your dog or to get some daily exercise. When you leave your home, you must maintain physical distancing of at least 2 meters from all other people at all times. If you live in the same household, you can go out and walk side by side, but only in groups of no more than 5, and not with people in your household who are sick or under self-isolation. After being out for these reasons, you should then return home as soon as possible. I also support the strong recommendations made by the Chief Medical Officer of Health for the province in respect of those over the age of 70, those with immune compromise or other medical conditions, for these individuals to stay home. I call on their friends, I call on their families and their neighbors to help make this staying home easy for them, as easy as possible for them, wherever you can. I continue to hear concerning reports of people ignoring our recommendations. Yesterday, I learned that someone removed the barricades and signs that were put in place in the Sunnyside Park parking lot. We've just heard about that. And apparently both the park and the parking lot were full of people. This is nothing short of appalling. People are getting sick. People are dying in our city. Yet others think that it's okay to hang out with their friends in groups of people. This behavior is selfish, and it contributes to virus spread in our community, and it is not acceptable. It puts all of our health at risk. I know it was a beautiful day outside yesterday, and we all want to go outside and enjoy the nice weather. But I want to be clear. I need to be clear around what physical distancing means. What this means is that everyone needs to stay home as much as possible, except for the essential reasons I mentioned earlier. It does not mean driving to a park that is barricaded for closure and taking down the barricades. This is not physical distancing. Impromptu street parties, allowing children to play with each other on the street while the parents socialize with each other. This is not physical distancing. These are real examples that are happening in our community, and they are not acceptable, not at this time. I recognize that it is not easy to stay home, especially as the warmer weather approaches. However, staying home is exactly what we need to do. We know that this virus spreads from person to person. People moving around in our community, coming into close contact with one another, within 2 meters of each other, is exactly how COVID-19 spreads. If we cannot find a way, if we do not stay home as much as possible, more people will get sick and more will die in our city. We are regularly assessing this outbreak, and we will adjust our measures as needed as our situation changes. We are doing this to protect our city, to minimize the loss of life, to manage pressures on our healthcare system, and to get our city back as soon as we can. As I said yesterday, the spread of the virus and the amount of time that we have to keep up with all these measures, school closures, work closures, staying at home, all of this is in our hands. The sooner we comply with these measures, and the better we all comply with these measures, the sooner we can make it through this challenge together. Please, stay home, stay safe, and take care of each other. I'll now hand it over to Chief Pegg.
Thank you, Dr. Davila, and good afternoon. Excuse me. There are 2 key issues I would like to update you on today. The first provides an update on actions being taken in our long-term care homes. As you know, we are experiencing significant increases in COVID-19 infections in our city-operated long-term care homes. The infections that we are seeing today are the result of either previous exposure to COVID-19 or community spread of COVID-19 that occurred up to 14 days ago. Since March 14, by provincial order, all non-essential and day-to-day long-term care home visits have been suspended. We have implemented every available option in order to ensure that both our long-term care resident care needs are being met and to ensure that our staff health and safety needs are being met. Our senior services and long-term care team implemented each of the recommendations that have been provided by Toronto Public Health since before the first reported case of COVID-19 in Canada. This includes fully implementing all Ministry of Health recommendations and directives. I would like to summarize the actions that have been taken to date. We have reassigned all non-essential seniors and long-term care divisional and management staff resources to meet the essential service needs in our long-term care homes. We are maximizing frontline staff availability through proactive scheduling and staff planning. We are bringing in as many people as possible to work overtime shifts in order to meet our staffing needs during the outbreaks. We are in the process of hiring 40 nursing students to support and backfill personal support worker positions. We have already redeployed over 70 city staff into our long-term care homes, and we have initiated the request for an additional 230 through the Emergency Operations Centre. We are redeploying 22 additional counselors to support frontline operations in our long-term care homes. Protective health monitoring and screening are in place in each of our homes, and enhanced cleaning is being completed and will be maintained in each home. All staff are wearing and are using the appropriate PPE at all times when inside any long-term care home. The second issue I would like to update you on today deals with personal protective equipment, or PPE for short. As the COVID-19 pandemic evolves, the requirements for appropriate PPE are increasing. As you know, the City of Toronto worked proactively to manage PPE, and we have robust processes in place to manage this important issue. The City of Toronto is fully connected with both the Province of Ontario and the Government of Canada on this issue. To be clear, in order to maximize buying and delivery power, the Government of Canada is coordinating the PPE supply chain directly, and they will provide the required PPE to the provinces for local distribution, including to the City of Toronto. Through our Emergency Operations Centre, we have formally requested the supply of the PPE that the City of Toronto will require. This includes the PPE needs for each of our frontline workers and first responders, along with our shelters, long-term care homes, and other city-operated facilities and programs. In total, we have requested the delivery of more than 184 million articles of personal protective equipment. This includes approximately 66 million N95 respirators, 28.5 million surgical masks, 31.5 million protective gowns, 446 million disposable protective gloves, and 4.5 million eye shields and other forms of eye protection. These requirements have been validated by the Medical Officer of Health. Our PPE needs assessment and corresponding supply chain requests are based upon the worst-case, full pandemic scenario and assume a 7-month supply duration. This is constantly being monitored and revised accordingly. The supply and delivery of PPE is being further complicated by an increasing amount of fake and otherwise fraudulent PPE that is being introduced into the global PPE supply chain. As a result, each level of government is having to take additional precautions and additional quality assurance checks before placing orders for or accepting delivery of PPE. In closing, I would like to remind everyone that the best choice for accurate and timely information relating to COVID-19 in Toronto is toronto.ca/COVID-19. Thank you.
Thank you, Chief. We'll go to questions. Again, remind journalists on the line that, excuse me, that we ask for 2 questions only, including a follow-up. First question is to Matt Bingley from Global News. Matt, go ahead.
Hi, Doctor. I just have a question about the number of deaths that you're reporting. Yesterday, at the end of the day, you released a number of deaths that seem to have been revised. Can you take us through how that has changed?
Yes, Matt, I can. So today I'm reporting 11 COVID-19 deaths. These are the ones that are formally recorded in the public health database, the information system that we use. And this is the number that I would use. These are the confirmed ones. I think that numbers that might have been reported yesterday were inflated in an effort to be responsive, and some deaths have been reported and attributed to COVID-19, but in fact, when you go into further detail, into further investigation, they turn out not to be appropriately attributed or counted amongst the COVID-19 deaths. So while we are seeking to be as responsive and as timely as possible, I think it's best that we focus on those deaths that we can absolutely 100% confirm and continue to do the investigation as necessary in order to confirm the other deaths. I will provide further details once those investigations have been completed by our team.
And, you know, this revision comes at a time when there are already concerns about the amount of information getting out and speed and accuracy. What concerns do you have about the amount of information you're able to get and give out?
Well, I think that this is always a challenge in respect of an outbreak. And when we look at particular populations, when we look at an older population, one that has existing chronic medical conditions, many of whom are near the end of life, if they are in settings where there is a risk of COVID-19, oftentimes they get attributed as one of the deaths associated with COVID-19, but subsequent investigation determines that, in fact, it is a death that's due to something else. Hence, I think we need to be very careful, ensure that the team has the time that it needs in order to do a thorough investigation, understand the circumstances of the death, so that we can provide the most accurate information. That still needs to be done in a timely fashion, and I recognize that that is challenging, but we will do everything in our power to ensure that we're providing accurate and timely information.
Thank you. We'll go to Austin Delaney from CTV. Go ahead, Austin.
Mr. Mayor, could you please paint a picture for me of what police will be doing? Will they be patrolling the streets and looking for people? And when does this start? And will there be a break? Will there be a warning? Or are you immediately issuing tickets?
Well, I'll let the police chief deal with the details of how the police carry out their business, but I will just say this. There have been plenty of warnings issued in a public manner. Whether there's individual warnings issued beyond that is up to the police in the exercise of their discretion. But I would say that the public have been warned many times about the fact that this was behavior that was causing a public health problem in our city or contributing to it. And now it is into the realm of enforcement, both of the bylaw that I've signed today and of the other orders that are already existing out there. And I just hope the police will do the usual good job they do of dealing with people in a way that is sensitive and considerate, but at the same time recognizing the gravity of this kind of behavior that people have been insisting on continuing to engage in. And on that note, Chief Saunders is now here and will deal with how police are going to handle people.
Thank you, Mayor. So in answer to that question, we'll be starting immediately with the enforcement aspect of it. We've started working with the COVID-19 enforcement team since March 21st, doing a lot of monitoring, doing a lot of education, doing a lot of helping people understand what the issue is at hand. So as we start, effective immediately, we'll be ramping up to approximately 160 uniform officers. We'll also have a complement of civilian folks, our special constables, as well as our parking enforcement officers that will be participating in this whole process. We'll be working with the city bylaw officers to make sure with their 200 extra resources that we have every opportunity to help in the situation in reducing the spread of COVID-19.
Follow-up, Austin?
And
Sorry.
as a follow-up?
Go ahead.
As a follow-up?
Yep, go ahead.
To Chief Pegg, did you say you have a worst-case scenario that this can go on for 7 months? Is that the thinking?
Hi, Austin, just to confirm, so no, it's not exactly. When we are calculating the personal protective equipment requirements, we assumed in our planning process, we assumed a full pandemic deployment, so what I described as a worst-case scenario. And for the purposes of distributing or making our order and our requirements known and I guess communicating them to both the province and the federal government, we assumed a seven-month duration. So not necessarily tied, in fact, not in any way tied to an estimate of the duration. That's just the business cycle, if you will, that for which we're planning PPE was in a 7-month increment.
Thank you. We'll go to Jennifer Pagliaro from the Toronto Star. Go ahead, Jennifer.
Hi there. For Mayor Tory, I'm wondering why the bylaw doesn't apply to other places. For example, does it apply to the TTC? We saw that there was a direction given by the union earlier today. Or does it apply to people walking on the sidewalk? Can you just clarify where this rule applies? And if so, why not these other places? Is that a legal issue?
Well, first of all, what we tried to do was, in putting the bylaw together, and of course I consulted with our lawyers and with the Chief Medical Officer of Health, we tried to address the areas where we had seen a problem happening on a fairly frequent and widespread basis, widespread meaning across the city. And the problems that we saw in fairly frequent numbers were in parks and public spaces. The options were presented to me with respect to sidewalks, for example, and parking lots was another one, municipally owned parking lots. And I felt that in the circumstances we should focus in on addressing where the problem had come up, where there had been this kind of willful and repeated disobedience of the advice and the previous orders that had been given, and that I had to balance, obviously, in all of these things when you are restricting people's liberties in a place, in a society in which we're quite used to being quite free to go about our business and walk around and so on, where it was reasonable and appropriate and required for us to restrict those liberties. So I think on the balance of all of that, we came up with the places where the problem has been in existence, namely parks and squares, and that's the bylaw that is in place. And if there are other problems, we can deal with that later. But I expect this will go a long way to addressing what has been the real nub of this problem so far.
And just a question for Chief Pegg, wondering if you could speak to the rules for PPE for shelter workers, harm reduction workers. There was guidance that was released by the province that doesn't really spell out if those workers are a priority. I know the city's been asking that. Can you just update us? Has the province responded to you, and how much PPE is needed for those frontline jobs?
Sure. So I'll start, and Mary Ann Bedard is here and can speak to the operations specifically within the shelter. So what I can explain, or what I can confirm rather, is that the quantum of personal protective equipment that we have asked for and that we have submitted into the now global, but certainly the federal supply chain request, is a compilation of the entire personal protective equipment requirements for the entire city. So that is all of the city divisions, all of the city agencies, including both frontline workers and first responders. So it is that quantum based on a full pandemic. And as I said, the quantum we were asked for, which is what we provided, was a 7-month worst case scenario, or 7-month full pandemic estimate. So that's what's gone in. I'll just step away and Mary Ann can speak directly.
Thank you. So, as every other city division, we take the health and safety of our employees extremely serious, especially for the work that they do in the shelter system. We've been following very closely Dr. Davila's advice, and we have instituted screening at all of our shelters. As part of that screening process, it is triggered when staff are required to wear PPE, and that trigger is when they encounter somebody who is symptomatic. We recognize that when we're dealing every day in the shelter with people who are not infected, as long as we maintain our IPAC cleaning standards and our physical distancing, we can accomplish not spreading COVID-19 in the shelter system. And we do want to make sure that we are managing our supplies of PPE appropriately and using them when it is appropriate to do so.
Okay, thank you. Next is Greg Ross from the CBC. Go ahead, Greg.
Okay, this is for Mayor Tory. Just want to ask where you think we draw the line when it comes to people in some of these parks and these facilities, because we are encouraging people to go out and to get exercise or walk the dog. So if we see people that are running in the park or riding their bikes in the park, could they be at risk of being fined as well?
Well, I think the bylaw is fairly clear, and certainly the guidance received from the medical officer of health today is fairly clear. That there are lots of circumstances in which it's perfectly okay to be in a park, most circumstances, in fact. And if you're 2 people, for example, or 3 people, and you all live together in the same household, then you can walk through the park, and as long as you stay away from other people that are in the park, other groups of people or individuals, it's all fine. We are not saying to people, don't go to the park. We are saying it's best if you stay home. It's best if you have the opportunity to if you're going to be out getting some fresh air, do it on a balcony or in a yard if you have one. But we are not saying you're prohibited from going to the park. If that was the intention, we would close all of the parks, as difficult as that might be for us. We're just asking people to engage in common sense behavior and to take account of the fact that they need to separate themselves from other people that they don't live with. The bylaw is meant to achieve that. The previous orders and advice given to people are meant to achieve that. And what we need now is just for people, the very few who are deciding they're going to, in effect, thumb their nose at this or whatever it is they think they're doing, to get in the game and to understand that this is a life or death matter. And so I believe that most people are doing that and will do that, but now we have to take the very few that have decided not to and get them to get on board with the rest of us and get this virus behind us as quickly as possible.
Well, we were out in the park today, and while there are many people that are, alone or maybe in a pair, they're not always practicing that social distancing, guidelines that we've put out. It's not necessarily 2 meters. They'll walk right past each other. Sometimes they'll stop and have conversations. What do you say to that? Are those people potentially at risk?
I have great confidence in the intelligence of the people of the City of Toronto. I've been through many issues with them as groups and as individuals. I think they actually do understand what the advice is from our Chief Medical Officer of Health. I think they do understand, or they're coming to understand, the grave threat that is posed by stopping to have those conversations, by those kinds of casual encounters we normally would think of as benign and, in fact, a pleasant part of living here. But I think they have to focus on the fact that we're in an emergency here. They need look no further than their television to see examples in places like New York where people are dying. People are dying here. We don't want to get to the stage where more people are dying. In fact, we want to stop that in its tracks and get back to our normal way of life, save lives, and protect the healthcare system. And so people just have to understand, a conversation that would have in peacetime seemed to be an ordinary and pleasant thing to do is just something now that is not, it's behavior we are trying to strongly discourage, if not entirely, have stop, because it's going to contribute to the spread of the virus. There are people who probably don't even know they might be carrying it, who are going to inadvertently give it to somebody else as part of one of those ordinary conversations for just a minute on a walking trail. So please, do what the medical officer of health has said, do what I've said, do what all kinds of other people have said, should be done all over the world, and just don't do it. Go to the park by yourself or with people you live with, and stay away from other people. We've been given very explicit guidance today as to how we can do that and cut down the spread of this virus.
Okay, thank you. We'll go to Francine Copen now from the Toronto Star. Francine?
Oh, hi. My question is for Chief Pegg. I wondered if you could walk me through the process. How does a bylaw officer approach someone from 6 feet away to inform or educate or give them a ticket? I mean, how do you get someone's attention? How do you give them a ticket from 6 feet away?
I'm just going to step away. I'll defer to Chief Saunders. One moment.
So as I stated earlier, the Toronto Police has been working with the city bylaw officers. Making the approach is not overly complicated. They will see a group of people that are not necessarily following what we're asking, and they will start the conversation. And most people, when you do have a conversation and really give them the facts as to what's going on, have a better understanding of the role that they can play in keeping the numbers down with the COVID-19. So there's no one dressed up as trees and hiding in bushes. You just walk, you see it. And I think that if we educate and continue to educate, as well as unfortunately utilizing a deterrent such as a monetary fine, we hope to move towards getting the desired effects that we're looking for.
Are they wearing, PPE, personal protective equipment, or are they just, dressed normally?
Well, no, and what you have to do is the more information and more knowledge that you have, the better that you can perform. So following all of the rules of keeping your distance and keeping your hands clean and making sure that you're asking the right questions and creating a proper environment where you're not transmitting as much as possible. The unfortunate part of being first responders is the fact that we have to breach that physical distance on a regular basis when we're interacting with people. And so everyone has a part to play, and if everyone does stay at home, you're actually helping the lives of the officers, of the firefighters, of the paramedics, of the nurses and doctors that are out there, because you're playing your role in keeping those numbers down overall.
Francine, one more thing on that. I'd be the happiest guy in town if we didn't issue a single ticket under this new bylaw because we didn't have to, because people just came to understand that they could stay 2 meters apart. But I should say that that may be necessary to issue tickets. There's an exemption, by the way, in the bylaw for bylaw and police officers who are carrying out their duty to be within the 2 meters. But I'm sure, as the police chief said, they will take all precautions necessary to make sure they don't put themselves at risk. But there's an exemption for them to do their jobs. But I hope they don't have any tickets to issue, because everybody decides at last, we're going to get in this game together, we're going to fight this thing, and we're going to do what we have to do to win this war.
Thank you.
Okay, thank you. We'll go now to Jenny Ewan from the Toronto Sun. Go ahead, Jenny.
Hi, this question is for Chief Pegg. I'm just wondering, you had mentioned counterfeit PPE. Do you have any idea how long of that would cause a stall in getting the real equipment out to cities and frontline workers who desperately need them at this point?
Thanks for the question. At this point, I don't have any specifics with respect to what type of delay that it is causing, although I can tell you it undoubtedly is. I know from our city, from our purchasing materials management division, up to our colleagues at the province of Ontario and, of course, the federal government now, we're having to implement additional processes that, frankly, ought to be unnecessary. It confounds me, frankly, that we have members of a global society that would resort to introducing and inducing fake and fraudulent PPE articles in the middle of a pandemic. I'm quite stymied by that, to be honest. But nonetheless, that is what's happening. We know of examples, fortunately haven't seen it here, but we know of examples around the world where well-meaning people are ordering personal protective equipment and things like masks, and when they are arriving, it's the combination of tissue paper and elastic bands. So obviously not offering anyone any benefit, wasting valuable time and resources, and causing everyone to have to put additional quality assurance checks in place. It's utterly ridiculous. I hope, beyond all hope, that the law enforcement agencies are able to effectively deal with that. I know that Chief Saunders' team has effectively already dealt with a number of fraud cases in Toronto, not necessarily relating to PPE, so I certainly commend my friend for that. But the fact that we're having to deal with this is extraordinary, and it just needs to stop. Unfortunately, it's our reality on a global basis.
A follow-up, Jenny?
I'm just wondering, with the supply chain request, do you know how quickly that might be fulfilled?
At this point, I don't. We haven't received any indication yet with respect to fulfillment times, but certainly something we're in constant connection and communication through our Emergency Operations Centre with the Province of Ontario, and of course through them to the Government of Canada, being tracked and monitored and observed and managed actively every day. So no fulfillment timeline as of yet, but certainly a very live issue around the clock for our EOC.
Okay, thank you, Chief. Shalima Maharaj from Global News. Shalima, go ahead.
Hi there, Chief. My question is more to do with long-term care facilities. Can you provide an update on the ongoing situation at Seven Oaks and within the City of Toronto?
So perhaps I can take that question. I can't get into specific details at Seven Oaks, but I know that I have been in conversation with the manager of our Senior Services and Long-Term Care Division here at the city. And I can tell you that there are a number of procedures and policies, everything that needs to be done from an infection prevention and control point of view is being done in the home. I do know that there are a number of deaths. There are some that are under investigation yet. And as I said earlier, I'm happy to provide confirmation on details once I have the investigations completed and more details are available. But suffice it to say that there has been an incredible amount of collaboration and coordination between Toronto Public Health and the city's long-term care homes in order to ensure the safety of the residents and the staff in all of those settings. Everything from active screening, enhanced cleaning, isolation of residents as soon as symptoms are identified, and a full assessment of all the infection prevention and control practices. I can also say that at Toronto Public Health, we've assigned staff specifically to support long-term care homes, the city-run long-term care homes, so that they have access to technical skills from a public health perspective to support their work.
Just to follow up, I know in the United States, obviously, we've seen a significant number of cases and deaths when it comes to long-term care homes. What can you say to reassure families with loved ones in care here in the City of Toronto?
Well, what I can say is that we have been working really around the clock with our partners in long-term care to ensure that all the available protections, everything that we have available to us, all of our knowledge in respect of infection prevention and control, all the measures that can be put into place, as I've outlined, everything from screening to restricting visitors, to ensuring that there is enhanced cleaning and disinfection, all the infection prevention and control practices, all the necessary personal protective equipment. All of these procedures, policies, measures have been put into place in order to protect the residents and staff in those settings. We're patently aware that COVID-19 is particularly hard on those who are on the older end of the age spectrum, those 70 years of age and older, and that would represent a significant proportion of those in our long-term care homes. We also know that this disease is particularly hard on those who have some kind of compromise to their immune system or have chronic medical conditions, and these are also prevalent within the long-term care setting. So we have been very, very carefully watching this situation, and I know for a fact that in the city long-term care homes in particular, because that's where I've had the greatest amount of collaboration and conversation over the course of the last several weeks, dating back to January, every effort has been taken in order to ensure the safety of the residents of those settings as well as the safety of the staff.
All right, thank you very much. This concludes today's media briefing. We'll talk to you tomorrow. Thank you.